Hello, I'm Dr. Atkin, chiropractor and master herbalist at Family Focus Chiropractic in Holly Springs, North Carolina, and today we're going to talk about low back pain. About 80% of Americans are going to experience back pain at some point in their lives, so we've got to get some real answers, and that's what we're going to be talking about today. Now, if you want to understand about low back pain, you're going to have to understand a little bit about how the spine and nervous system works, so let's quickly review that. When you look at a side view of the nervous system, the brain's sitting right up here. An extension of the brain called the brainstem comes down through a hole in the bottom of the skull, becomes the spinal cord, and runs all the way down to the tailbone. Nerves are exiting out in between those spinal bones, running to every single muscle, cell, tissue, and organ in your body. And that's the way that the body communicates, and therefore the way that the body heals is by sending healing messages down that spinal cord and out through the nerves to the rest of the body. So let's take a look at a plastic model of the spine. Now, when we experience low back pain, a lot of it comes right here at the very base of the spine, right in the dead center. A lot of you are probably rubbing that right now, knowing exactly what I'm talking about. Sometimes it happens a little bit off to the right or a little bit off to the left, and that's because that's where the joints that connect your hips into your spine are at. So the reason that so many people experience low back pain is that often there's some type of an injury. Maybe it is a car accident or a sports injury, a slip and fall. What happens is that if those injuries cause the spine to shift out of position, what happens to these little nerves that you see coming out in between those spinal bones? If the spine shifts out of position, it can put pressure on those nerves, and therefore there's nerve interference. And when there's nerve interference, those signals being sent back and forth between the brain and the rest of the body are no longer able to go through properly. Now, since those nerves are communicating to the muscles, if there's a breakdown in communications, sometimes the muscles can get too tight or too loose, and so muscle spasm often results. When there's muscle spasms, the body's attempt to correct that is to send fluid into the area. So you get swelling and inflammation, which can also become painful. If all that's left there long enough, over the days, months, years, and decades, your spine degenerates. So what's the problem? Well, injuries or other types of stress cause the spine to shift out of place, causing nerve interference because there's pressure on the nerve, and therefore resulting in muscle spasm, swelling and inflammation, and degeneration. Not only can this be caused by big injuries and accidents, but it's also the daily repetitive things that happen. If we have bad posture, if we're sitting all day long or standing on our feet, there's even emotional and nutritional stresses that can cause it. But that's the source of the low back pain. Now, not only is there low back pain, but when you look at this chart here, these nerves are going to many different parts throughout their body. They're going to different parts of our digestive system and reproductive system. If there's nerve interference, then we can even be experiencing problems in those organs. Or what about the nerves that are coming down our leg? Have you ever had sciatic pain where there's pain going down the back of the leg, or maybe into the knee or ankle or foot? Either way, if the spine is shifted out of position, that's a real cause of low back pain, and it may be what's going on. In fact, you need to know whether there's any nerve interference in your spine. How do you find that out? Well, we have state-of-the-art scanning technology. There's a muscle scan and a nerve scan that allows us to pinpoint exactly what's going on. We'll do a full examination of your spine, digital posture analysis, range of motion. We'll sit down and we'll discuss your case history to really understand what's happening. And then we'll be able to print out all those reports and sit down and have a detailed conversation and show you exactly what's going on within your lower back and your spine and nervous system. And if we find a problem, we'll talk about what the solution is, which certainly involves gently realigning your spine so that we can remove that nerve interference and therefore reduce the muscle spasm, degeneration, and swelling and inflammation. So click on the link below or give our office a call. Let's schedule a time to sit down and go through it. I look forward to talking to you soon.